Hello, welcome to my restorative physical therapy. I'm Dr. Jenny Pruitt, and today we are going to be talking about hand arthritis. So a little bit of anatomy first of the hand. So lots of bones, lots of small pieces, very complicated. I'll try and make this as simple as possible. So we call the thumb digit 1, and then we have digits 2, 3, 4, and 5. In these 4, we have 3 bones that make up the finger itself. We have the proximal, middle, and distal phalanx. This joint here we call the proximal interphalangeal joint, and this last one here we call the distal interphalangeal joint. We have long bones that go through the palm of the hand. Those are your metacarpals. So where they interact here, we call that a metacarpophalangeal joint. Those long bones interact in the wrist with the carpals, and those are small, tiny pebble-shaped bones, pebble-sized bones. And where they interact, we call it carpometacarpal joints. When you develop arthritis in your hand, it's actually possible to develop arthritis in any one of those joints. You may feel stiffness or warmth or tenderness in one or several of those joints. Interestingly, the most common joint in the entire human body to develop arthritis in is this first CMC, carpometacarpal joint, at the base of the thumb on your dominant hand. So no matter where your arthritis is striking, this tip sheet is a good one for you. Typically, you don't need to see a doctor because the hallmark signs are stiffness, pain, warmth, maybe a little bit of swelling at those joints, but there's nothing really that you need to jump in to see the doctor for unless it's actually not arthritis. So say your pain started because of a fall, and you may possibly have a fracture, then that's a time to hop in to see the doctor. Or say you had a hyperextension injury and you may have actually sprained or overstretched a ligament in one of your digits. That's also a time where you should theoretically hop in to see a doctor. But if it's just over time, you develop stiffness and swelling and warmth in one or multiple of your joints, then you don't really need to hop in to see a doctor. If you have had base of the thumb pain, arthritis, for a really, really long time, and it feels unstable and it's just nagging at you and it's not really feeling great, they actually do a version of a joint replacement in the thumb to help it feel better and to improve your function. So if you do think that is you, seeing a hand specialist, a hand surgeon, would be somewhere you would go. But otherwise, if you're just kind of that basic stiffness, soreness, hands just aren't moving and helping you with your function as much as you would like, the way they used to, and you're looking for some top tips and exercises, you can head on over to the tip sheet now.